He can't have any biscuits with his diet at the moment because he's on softer foods, I think.
Paula Miller says her family was lucky to find an adult care home for their father that was close enough to visit regularly.
When he first came out of the hospital, the nearest one that they suggested was probably about an hour and 30 minutes from here. Which, of course, you can go any length, any distance for your family, but having it here in Docking it's maybe 10 minutes from my brother's home. So it's wonderful.
But now the facility's future, as well as the future of similar homes throughout the UK, could be at risk, thanks to severe staffing shortages caused in part by Brexit.
I don't really keep up with the Brexit situation, but I'm just hoping and praying that it doesn't affect the carers here, because if this place closes, I don't know what local people would do.
Adult social care differs from the rest of the UK's healthcare system. It relies on private companies rather than a government-run system like the NHS. The sector depends on EU nationals for a sizable chunk of its workforce. About 9% of England's adult social care workers hail from EU countries, compared to 5.5% in the NHS. The EU's freedom of movement laws previously made it much easier for care homes to recruit EU nationals, but those regulations won't apply to the UK after Brexit.
What we've found that since the referendum several years ago, the number of applicants that we're getting from Europe has dwindled to virtually nothing.
Raj Siegel is the managing director for the UK social care company Armscare. The company provides housing and care services to elderly patients as well as those suffering from dementia or Alzheimer's. Siegel says Brexit's uncertainty has already put that labor pool in jeopardy. EU workers are leaving the country or choosing not to emigrate to the UK.
There will be care facilities that will shut down and close, and I'm aware of local care homes here that are suffering with quality issues that are on the verge of closing down because they haven't got the right calibre and quality of staff simply because they're not available.
Siegel told Newsy his care home used to employ 8 or 9 EU nationals. Now it only employs 1. Fewer staff means less ability to care for patients, which can lead to care homes having to turn more people away. Retaining social care workers was a difficult task even before Brexit. Skills for Care, an adult social care charity, notes the sector had a 30.8% turnover rate with 122,000 job vacancies across England.
One of the reasons why it's so difficult to recruit in this sector is because it requires a special type of person. It's not for everyone, and I do understand that, but it does take a very special person to be able to do all of these things and to kind of take it on the chin so that they can deliver the best care possible.
UK Prime Minister Boris Johnson has floated the idea of a points-based immigration system for EU nationals arriving in the country after Brexit. That kind of system would privilege workers with higher levels of education, wealth, and language proficiency, but not necessarily the temporary workers that staff adult social care homes.
Nobody's prepared to stick their neck out and actually make a decision and say, yes, the European workforce is drying up, the local workforce doesn't want to do this particular job, we have to recruit from somewhere, so let's open up our doors on a points-based system to employers like ourselves who actually need staff.